Today I've got Jenna Kluwe, and she is here. She's one of our integration coaches, and she's here to talk about personality disorder and psychedelics, which is a big topic because that's one of those that most people think you can't take psychedelics when you've got borderline personality disorder. So, welcome, Jenna.
Thank you.
If you'll just tell me a little bit about yourself, and then talk a little bit about personality disorder.
Okay, perfect. Jenna, I used to be a therapist for about 16 years or so, and my specialty was borderline personality disorder. I don't know, 14 years ago, I got trained in dialectical behavior therapy, which is the main treatment for borderline personality disorder, and that's when I shifted my specialty and really started focusing on helping those folks. And what borderline personality disorder is, like, we can look at it two different ways. There's the DSM-5 symptoms. If you want me to go over those, I can.
Yeah, I'd love to know. Yeah.
Okay. So a diagnosis for borderline personality disorder requires at least 5 of the following symptoms. And tell me if I go too fast. Sometimes I read.
Okay.
So frantic efforts to avoid real or imagined abandonment. This does not include suicidal or self-mutilating behavior. That'll be covered in another symptom. Pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. Markedly and persistent unstable self-image or sense of self. Impulsivity in at least 2 areas that are potentially self-damaging, like spending, sex, substance abuse, reckless driving, binge eating, things like that. And then reoccurrent suicidal behavior, gestures, threats, or self-mutilating behaviors. Affective instability due to marked reactivity of mood, so really intense ups and downs of emotions. Chronic feelings of emptiness, inappropriate, intense anger or difficulty controlling anger, and transient stress-related paranoid ideation or severe dissociative symptoms. So those are like.
Do you have to
5?
5. Okay.
Yeah, you have to have 5 to meet that diagnosis. But the creator of dialectical behavior therapy, which I'll call DBT probably from now on, she talks about it. That's Marsha Linehan, by the way. She's fabulous. She talks about this diagnosis as 5 types of dysregulation. And I like to talk about that more because it kind of covers all of those things in these 5 different categories.
Okay.
It's easier for people to remember and understand. So those 5 types are emotional dysregulation, interpersonal dysregulation, cognitive dysregulation, self-dysregulation, and behavioral dysregulation. And so, like, emotional dysregulation talks about the anger outbursts and the affective instability. Interpersonal is that that unstable, intense interpersonal relationship stuff. The cognitive one is the stress-related paranoid ideation or dissociating type symptoms.
Mm-hmm.
Behavioral is more of that impulsivity, suicidal behaviors, self-harming behaviors, and then the self is that unstable sense of self.
And impulsivity, give me what kind of impulsivity?
I'm gonna go
Dangerous
stuff, things that are not helpful to their current state usually.
Okay.
This is if you can see some of those, it's often misdiagnosed as bipolar disorder because people go on like spending sprees or have really reckless sexual behaviors, stuff like that. That's really impulsive and they just get it in their head and do it.
Okay.
So that with the ups and downs of moods and stuff, it does kind of look like bipolar.
It resembles bipolar.
Yeah.
So is this down the board? Somebody has to meet these 5, at least 5 of these.
Yeah.
To be diagnosed. Okay.
Yeah. And so in the psychedelic world, bipolar disorder, of course, is one of those that is also not usually allowed into their studies, and it's a contraindicated diagnosis. And it similarly to borderline personality disorder for a lot of the similar reasons, that impulsivity stuff, the suicidal ideation, the chronic suicidal ideation. And it's not necessarily like they're always ready to go commit suicide, but it's like a constant thought in their head of life is just not worth living, kind of a thing. And then the unstable sense of self and the cognitive dysregulation pieces are the ones that people are very concerned about when it comes to psychedelics.
And what medication is generally prescribed for that? And is that the reason why people are fearful of this in psychedelics?
There is yet to be a medication that is indicated specifically for borderline personality disorder. Often folks will get some antidepressants and SSRIs, or they will also get some mood stabilizers. Some people get antipsychotics prescribed to them. And so a nice wide range of medications are thrown at folks, and none of them are indicated for borderline personality disorder. They just kind of take the edge off for a lot of these symptoms. Yeah.
And which makes it a big no-no for psychedelic therapy for most.
Yeah. For most. Mm-hmm.
Okay.
Yeah. But I disagree. I don't think it should be left out. And that's a huge part of why I wanted to talk with you guys and what I've been kind of, I don't know what you want to call it. This is what I'm out talking about right now. It's kind of upsetting. There's a huge stigma against this disorder, and it really bothers me. When I was a therapist, I would tell people what I specialized in, and they'd be like, you do what? Like, seriously, I got some people that reacted in that way of like, oh, you do what? You treat who? I'm like, fucking really?
Why do you think that is? Why do you think that is? Because of the story that's been put out there, right?
Exactly.
And what's
the huge stigma that these folks are manipulative, are impossible to treat, a bunch of stuff. And that there wasn't a good treatment for these folks before DBT came along. So this is a long-standing stigma that just hasn't really gone anywhere since DBT came along. And that's been around for since the early 90s. Really got popular in the early 2000s. But it's still there. That stigma is still there. So when I started getting some trainings and going into the psychedelic symposiums and conferences and things like that, I kept hearing over and over again the 3 big diagnoses you don't use psychedelics with: schizophrenia, bipolar disorder, and borderline personality disorder. Like, definitely not. I'm like, what? And I'm sitting there with a couple years now of having folks come to me in sessions saying, hey, I ate mushrooms this weekend, I need to talk about it. And we'd talk about it, and it was a huge piece of their therapy turned into, and how this was helping them. And I'm like, so I'm hearing all this from like trainers and stuff in the psychedelic world. I'm like, but no, I've been seeing people get tremendous help from these medicines for a couple of years now. And then, so I decided to go forth, and this is what I wanted to specialize in, is helping these folks use these medicines in a safe way. I definitely can see how some of the symptoms and that so let me back up. Those 5 types of dysregulation are all kind of on a spectrum, right? So you want to look at where people are at on the spectrum for those 5 things. Like, if they're highly suicidal, that goes for people with depression. If they're super highly suicidal, you're going to want to stabilize that a little bit and make sure there's supports and really address that before they step into the medicine space, right? Same for these folks. Like, yes, they have that symptom, and you need to make sure they're down. There's multiple diagnoses out there that include psychosis, including major depression, and severe with psychotic features. If some folks are really, really ill with that disorder, they could be experiencing psychosis as well, which is the same for folks with borderline personality disorder. Again, it's that spectrum. Like, most people don't hallucinate, and a lot of them dissociate, but to different levels, again, on the spectrum. And if they're really high on that spectrum, then probably don't want to work with medicine right now. And there's ways to stabilize that to be able to then work with medicine. So the psychosis, the impulsivity, the sense of self. Folks with this disorder, that's it's one of the 5, right? It's this unstable sense of self. And we have to be really careful about giving them a medicine that's going to shatter their ego of, the little bit of foundation that they do have of a sense of self gets blown away. We need to make sure they're prepared for that, and that we're aware of where they're at with that and very careful in that situation. And that's another thing that I've had people ask me about that one in particular is like, what about the sense of self? Like, how can you go giving these people medicine that is just going to blow them out of the water and dissolve their ego? And they already are very unstable with that. So, yep. Again, on the spectrum, we need to work on that. There's some skill building to be had to start building those foundations and being very, very transparent about this is what the medicine can do. This is what it might look like. I'm going to be there to support you afterwards to help rebuild those foundations, and gain that sense of self back if it goes. Or had multiple people really identify with who they are after using the medicine and be able to have that sense of self after working with the medicine. So
It sounds like it's very individualized. You can't just it's each person. It's individual, and you really have to assess what's going on with that person and where they are.
absolutely. So I don't think that someone walking, I don't know how much you know about the Oregon stuff going on here, Measure 109 and stuff, but we're about to be launching our psilocybin therapies here. I'm not aware of what the treatment programs look like as far as what they're trained in different mental health diagnoses, but this isn't meant to be a medical treatment or a medical model. So I don't know how much they're getting trained in this. So it would concern me having someone who, let's say, is a young adult with very little experience with folks stepping into the medicine space with people with this diagnosis without knowing how to assess for things like these things. So I would definitely caution folks, just, don't think that you can go and help everybody. Know that there's limitations and that you need to have a scope of practice going into this. And if you've never worked with these individuals, then maybe these people are folks that you refer to people who have. But I do not think that should leave these folks out of this space. So I'm on a mission to gather the folks who work with BPD and start coming together to see how we can help these folks in this space in a responsible, good way to help them, not harm them.
It's about education.
Yes. Yeah.
It's about education and changing that story.
Absolutely.
So I want to touch on medications again. And I know there's not a specific medication for this, but I think that it's the medications that people are on, that people have to be really honest about when going to ceremony, when going to whatever you're going to do, talking to your therapist, whoever you're talking to. But it's about those medications and the contradictions to some of these plant medicines, such as ayahuasca. Psilocybin, not as much. It's much less of a contradictor to these. But talk to me about that and how to be safe.
Yes, I do not recommend people just go off their medication. That would be something to work on over a long period of time to taper off anything that would be a contraindication to take when you're using these medicines. I think what I keep coming back to is like what my model of helping these folks are, and it's that prep stage. When you start to think about wanting to work with this medication, preparation with me is going to take 5 to 6 months, and then you still might not work with the medicine at that point. There's going to be a lot of skills training involved to start tapering off as you're tapering off these medications that you can't be on if you're going to use the medicine, and having a lot of skills and support in place as that's happening. But you can taper off. I've had multiple people do that, but don't just stop your medicine. I hope nobody thinks that that's a good idea, because there's a lot of dangerous things that happen when you just cold turkey your psychotropics. Not good. But what's that?
Nor being dishonest about it when going to ceremony or to use these plant medicines.
Exactly. Yeah, because that's not going to result in a good outcome for you. So you definitely don't want to hide the fact that you're taking these medicines. And some people have tried, like with SSRIs, for example. that's been something that I've really been following and looking into. Erica Zeflin is out here in Portland, is a naturopath doctor who's been talking about how you could still remain on your SSRIs and use psilocybin, for example. And it's just a much higher dose of psilocybin. So definitely consulting with different folks who are trailblazing this and doing studies and working on this, because as of now, most people are told you can't take your SSRIs at all, it won't work. And a lot of people have that experience of like, I didn't feel anything because your SSRIs were blocking it and you couldn't get the medicine to your neurons. But there, like I said, there's her and there's a couple other people, I'm not getting their name right now, that are really working on this and seeing what the possibilities are, is to at least maintain a low level of SSRI dose along with a high level of psilocybin dose.
I see somebody said about the spirit pharmacist giving
Yeah,
consultation.
Ben Melson, that's one. Yep.
Mm-hmm.
Yeah, he has a lot of information. I want to say he recently published some stuff on that too. So definitely check him out.
Yeah, we're going to try to get him on here for sure. It's a great information.
Yeah.
Shoot, I just had another question that came through my head. Oh, okay. Let's talk about microdosing and having bipolar personality disorder. Again, is it about the medications and microdosing? Is microdosing okay? Talk to us about that.
I don't do a ton of microdosing work with folks yet. I'm still feeling like I need to up my own practice and knowledge around that area, specifically with people who have medications that they take. This is why I've been diving into some of those studies to really see, because I've also been seeing some people who are able to taper off their medication by microdosing. And then they don't have all those negative side effects of stopping their medication. And then they're able to take a macrodose and sit with the medicine at a macrodose level and are seeing some good benefits there. I haven't worked with people specifically around microdosing in this area, but I'm looking into things because it's fascinating. One of my mantras, a lot of my clients probably remember, is skills before pills. And the less pills we can take, the better. I very much, again, psychotropics can be very helpful and very needed. And they, from what they've never, as far as I can tell, I mean, pharmaceutical companies might say otherwise, but from my understanding of all of these medicines, is they're not meant to be like a lifelong thing. And all of them start to have a lot of negative side effects along with them. And you have to start taking other meds to contradict the side effects that keep coming. And the tardive dyskinesia symptom is huge, especially for folks who have to take antipsychotics. That's very, and then now there's a new med out to help combat that. It's like, I hate that idea of just let's start stacking more and more meds on, when there's the potential to use plant medicine to start weaning off these on a microdose level and then macrodosing. And that's one thing with this diagnosis, is there are no medications that are shown to be effective in long-term treatment for them. And what has been effective is dialectical behavior therapy. That is what cures, if you will, this diagnosis. I don't think anything's ever 100% cured. There's still going to be some things that pop up for folks, but over and over and over again, I've treated folks that no longer meet criteria for this diagnosis after working in DBT and building their skills and being very, very dedicated to implementing the skills that they learn and using that. And this is where another big reason why I'm advocating psychedelics for this is the neuroplasticity capability of psychedelics versus psychotropics. Borderline personality disorder is considered one of the fixed diagnoses, meaning that like medication doesn't really help it. It just helps the symptoms and makes it a little better, but it's always going to be there. And that is so not true. So not true. I've seen many people sitting in my office and have been able to tell them that they no longer qualify for this diagnosis after using skills, and after changing their brain and their pathways and being able to have different automatic thoughts and different automatic behaviors, and psychedelics. Now that I've said psychotropics, I
Yeah,
can't
yeah,
say
it's stuck in your mouth.
psychedelics tremendously increase the brain's ability for neuroplasticity. So having sitting with the medicine and then really working on your skill building and working on changing those pathways and those negative thoughts and those very fixed beliefs and things, it can flip the switch for people pretty fast and help really solidify the new pathways and help them be better.
Well, I mean, it just makes sense that somebody could get, I don't know what the word is, undiagnosed once they've been diagnosed. I mean, if you start checking off those boxes, okay, I don't have that suicidal ideation anymore because I've healed at a cellular level and that shit is gone. And so it's just gone, right?
Yeah,
Whatever gets it gone, it's gone. So check that one off. Well, now I only have 3 of them, so I don't qualify. I mean, it just makes sense.
amazing. Yeah.
Hmm.
Yep. And these
Hmm.
medicines can help really accelerate that process for folks. So I think it should be very, very available for them with care and with caution. Mhm.
So if somebody has has this diagnosis, is on different medications, is seeing a psychiatrist, a therapist, whatever they're whoever they're seeing, and is interested in doing plant medicines, and they call you, you will set out. I mean, it's an individual thing, but you go through a process. Could be 5 months, 6 months, and like you said, maybe even then they're not going to the medicine yet.
Yeah.
Hmm.
Yep, it's a very individualized process. Some people who have been through DBT before already kind of have an idea of those skills. So it would really be, so working with me would look like, okay, so now we're going to implement those skills. And I'm a coach now, a psychedelic integration and wellness coach now, because I want to focus on this education and coaching people and getting these skills and really applying them instead of just showing up to their therapist and saying, because there's a lot of other things that therapy does to help these folks. There's a lot of other pieces to it. So instead of spending my time with folks going through like the diary card and what happened this week, and I still ask what happened this week, but now, okay, what are the skills that we talked about? How did you implement them? How could you change, implemented them in that situation? And then really working on changing those pathways around behaviors and thoughts. And then also regulating emotions comes with that. And then I would be talking with their psychiatrist and therapist also. So that's part of my program, I guess you want to call it that. Is
So
that
you talk with their therapist,
yeah, yeah,
doctor.
be working on, I believe that creating a community around these folks to help them and support them is really, really important. So the more I've had a couple of people, but oh, you want to talk to them? Absolutely, I want to talk to them. Yes, because they know you for how long, or we can work together in so many different ways. They have what they need to do for their therapeutic interventions for you, and I will be having behavioral coaching interventions for you. So we will be working together on 2 separate things that really come together, and I need to be working with them. Um, Psychiatrists, I've come across a few who are absolutely amazing and agree with the skills before pills motto, and totally recognize, like, I'm just here to give band-aids and to help them. Like, you all are the ones doing the work, like helping them do the work to get past this. And so hopefully someday they won't have to take these medicines. I've also had a few that are like, nope, they must be on these medicines. I don't know what you're talking about. And
Yeah,
so, um,
yeah,
yeah,
yeah. The story is strong in their head.
exactly.
Yeah, yeah. Okay. So if somebody needs to find you, they can find you through the plant medicine path.
Yep.
Um, we can connect you with Jenna. You're in Oregon, but you are also online, so you can help
Yep.
folks virtually.
Yep. Totally.
Yeah, it's very cool what you're doing, and
Thank
I
you.
appreciate you bringing this to the forefront because Mark and I have been in this space just a short time, a few years, and definitely what has been taught to us is anybody with these on these medications, whatever the diagnosis is, anybody with these diagnoses or on these medications, stay clear, stay clear, you know.
Yeah.
It's dangerous, dangerous, dangerous. And I appreciate you coming on and talking that there is a safe way. Not everybody can use plant medicines. Let's just
No,
put that out there right now.
absolutely. Yes.
It
Yeah.
can be dangerous for some people.
Absolutely. It can be. And that doesn't mean that a whole group of people should get shut out.
Right.
Yeah.
Right. It's individual. It's that
Mhm.
story in our head.
Yeah, exactly.
Yeah. We're trying to change that story. That's what we're doing. So
That's,
we
that's
appreciate you coming on.
Thank you. Thank you for having me. I feel like yeah. The very first time I heard that in the psychedelic space, I was like, oh no, it's here too. I'm like, I want to scream it from the rooftops. A, these people are not people you need to run from when you hear this diagnosis. It's terrible. B, they can be helped with these medicines too, safely. And it's just, a matter of having skills, recognizing, if you have the scope of practice to be able to help these folks, and if you don't, building your network referral system to be able to give them off to somebody who can.
Right. Who understands and can do this safely.
Yeah.
Because again, we are not advocating that anybody who's been diagnosed with borderline personality disorder or any of these, anything else, we are not saying just go out and do plant medicines by any means.
No, it can be incredibly dangerous and shattering for folks to do this, especially unsupported. So again, I have a very long prep stage to help to make sure that this is a safe thing for them to do and pursue.
Yes. Right. Well, thank you so much.
Thank you for having me.
Yeah, we appreciate you so much, Jenna, and we are here to help you get in touch with Jenna. So, all right, thank you so much. We appreciate you.
Yes, appreciate you
Find us
too.
down the Plant Medicine Path if you have any questions. Thank you so much. We'll continue this discussion.
Yes, please.